Hello, dear friend. Happy to see you again today in our class. Today, I'm going to talk about how to treatment and diagnose and management of cervicitis. I'm going to talk about two types of cervicitis. One is chronic and one is acute cervicitis. So let's go through this PowerPoint. Yes. Okay, as you know, we have it is me, Leila Mustafi. I am Senior Consultant, International Trainer in OB/GYN and midwifery with more than 10 years experience in international training, management, and clinical practice in Middle East, Europe, and in Asia. So we are going to talk about cervicitis. First, I'm going to talk about etiology, symptoms, and signs, diagnose, and treatment, key points, and at the end we will have some case study, and I want you to go for some self-assessment. This is one cervicitis, as most of you must seen in your clinics. What is the definition of cervicitis? Cervicitis is infectious or non-infectious inflammation of the cervix. Findings may include vaginal discharge, vaginal bleeding, and cervical erythema and friability. Okay, so well, I should clean this. Yeah, because so much I did. Okay. So when you find some of these findings, you have suspicion. You have the patient which should go for infectious screening. So women are tested for infectious cause of vaginosis and plus pelvic inflammatory diseases, and are usually treated with all of these chlamydial infection and gonorrhea. As you see, I show you here different type of cervix. It is healthy cervix, this is early stage cervix, and this is chronic cervix stage. Acute cervicitis is usually caused by an infection. Chronic cervicitis is usually not caused by an infection. Cervicitis may be ascend and cause endometriosis and pelvic inflammatory diseases. And what about the etiology of cervicitis? The most common infectious cause of cervicitis is here, yes, chlamydia, trichomonasis, followed by Neisseria gonorrhea. They are sexually transmitted. Other causes include herpes simplex virus, Trichomonas vaginalis, and Mycoplasma genitalia. Other pathogen cannot be identified. Their cervix may also be inflamed as a partial vaginitis, like bacterial vaginitis or trichomonasis. Non-infectious causes of cervicitis include gynecologic procedures or some foreign bodies like pessorious barrier conception devices and chemical and very many things like some cream or allergens may happen for these cervicitis. Cervicitis, as you see as a sign, cervicitis may not cause symptoms. The most common symptoms are vaginal discharge and vaginal bleeding between menstrual periods or after coitus. As you see, this bleeding happens from this part. Menstrual, and some women have some dyspareunia, vulvar and or vaginal irritation, or dysuria, like mucopurulent cervicitis. And about diagnosis of cervicitis. As you see, cervicitis, first you should go through clinical finding, then testing for vaginal testing for vaginitis and STI, plus you can check cervicitis diagnose if women have some cervical excuse and plus finding that suggests a specific cause or other disorders, including like fever, pelvic inflammatory diseases, or HSV infection, plus cervical motion tenderness. We can find some other issue like some HSV infection or vaginal pain or vulvar pain, plus many other things that can goes to your diagnosis. We have different type of cause of cervicitis. One of that is chlamydial cervicitis. That, as you know, in United States, chlamydial genital infection is the most frequently reported infectious disease, and the prevalence is highest in person aged less than 25 years and above. Microbiology etiologic agent is most in chlamydial trichomonasis, an obligatory intracellular bacteria infect its columnar epithelial cells. Survived by replicate that result in the death of the cell. And in acute cervicitis diagnosis, most we are looking for endocervical canal green or yellow color of the mucus. Cervix is friable or easily induced to bleed. An increased number of neutrophils, 30 per high power field, you will see. Plus, in this kind, you will check about intracellular gram-negative diplococcal gonococcal endocervicitis and negative for gonococcal chlamydial cervicitis. So test for both gonorrhea and chlamydia, preferably using PCR, should be perfect. What about chronic cervicitis? Actually, the pathology of the chronic cervicitis, you will see most cervical polyps. As you see here, I make it a little bigger for you. Yeah, as you see here, this is the polyps. You will see the cervical polyps in different. Some of them is flat and some of them is like this. Cervical polyps are small, smooth, red, finger-like growth in the passage extending from the uterus in the vaginal. And you will see from the cervical channel, you will see such this shape. And in chronic cervicitis, first of all, in chronic cervicitis, you will see pathology of chronic cervicitis. It's happening when the surface of the cervix is replaced with inflamed tissue from the cervical channel. The condition may be caused by trauma, infection, or chemical. As you see here, and here is the shape in the speculum. Treatment for cervicitis, usually empiric. Treatment for chlamydial infection and gonorrhea is needed. After the first visit, most women with acute cervicitis should be treated for chlamydial infection. And because most of them, especially if they have some risk factor for STI, like age less than 25 years, new or multiple sex partner, or if they have unprotected sex, or they have some other risk factors, they have to follow up, and their follow-up should be ensured. Women should also be treated empirically for gonorrhea. And don't forget, you have to check about risk factor for STI. If it is like that, you have to ensure them to have further follow-up. Treatment for cervicitis consists of this following. Chlamydial infection should go through azithromycin 1 gram orally once, or with doxycycline 100 milligram orally twice a day for 7 days. Treatment for gonorrhea will be for ceftriaxone 500 milligram IM once for patients weighing less than 150 kg, and plus azithromycin 1 gram orally once due to emerging resistance of Neisseria gonorrhea or cephalosporins. The next, if cervicitis persists despite this treatment, what you should do? And if it gets some reinfection with chlamydia or Neisseria gonorrhea, it should be ruled out. And empiric treatment with first is, yes, let me I make it a little big. So yeah, the first treatment is moxifloxacin 400 milligram orally once a day for 7 to 14 days and for 10 days. Should be started to cover possible genitalium infection. If the cause is bacterial STI, so sex partners should be considered as well. I think I am running out of the time. And for the other, yes. And for the acute cervicitis, it is cefixime, ceftriaxone, ciprofloxacin, ofloxacin, and levofloxacin. For chronic cervicitis, you have to think about physical treatment like electrocautery, laser, freezing, and HIFU, then medicine, and then operation. And for chronic cervicitis, don't forget, first of all, select treatment according patient age and desire for pregnancy, whether she's presently pregnant or is breastfeeding, the severity of the cervical infection, the presence of complicating factors, previous treatment, surgical process that she has, and cryosurgery or electrocauterization or laser therapy. This is the key point that you have to consider. Acute cervicitis is usually caused by an STI and passage PID. Infection may be asymptomatic test, women for chlamydial infection, gonorrhea, bacterial vaginosis, and trichomonasis, and test most women for chlamydial infection. I hope you could get enough and proper information from this small shorting class. And if you have any more questions, just you can contact me with my email address, info@lilymcenter.com, or through our website, www.lilymcenter.com. If you like this class, please don't hesitate to like, share, and subscribe our YouTube channel, Lily Excellence Center. Thank you again for your patience and staying with us. Hope to see you again. See you.